As discussed earlier, Symbicort, budesonide 160 micrograms, formoterol fumarate dihydrate 4.5 micrograms, is taken using an inhaler. The following instructions will help guide you through the steps to prepare and use your Symbicort inhaler. Before using your Symbicort inhaler for the first time, it is important to prepare or prime the inhaler. To prime your inhaler, hold it upright, shake well for 5 seconds, remove the mouthpiece cover, and then face the inhaler away from you and release a test spray. Shake it again for 5 seconds and release a second test spray. You are now ready to use your inhaler. You will need to prime your inhaler again if you haven't used it for more than 7 days or if you drop it. Before every use, shake your inhaler well for 5 seconds. Carefully remove the mouthpiece cover by squeezing gently at both sides, then pulling out. Make sure to check the mouthpiece for foreign objects before using the inhaler. Breathe out fully, place the mouthpiece into your mouth, and close your lips around it. Make sure that the inhaler is upright and that the opening of the mouthpiece is pointing towards the back of your throat. Inhale deeply and slowly while pressing down firmly and fully on the top of the counter on the inhaler. Keep breathing in deeply and hold your breath for about 10 seconds or for as long as you are comfortable. Before you breathe out, release your finger from the top of the counter. Keep the inhaler upright and remove from your mouth. For your second puff, shake the Symbicort inhaler again for 5 seconds and repeat exactly the same steps just described. After you finish inhaling 2 puffs of Symbicort, close the mouthpiece cover by pushing until it clicks in place. Immediately after using your inhaler, rinse your mouth with water and spit out the water. Do not swallow it. Also, please do not share your Symbicort inhaler with another person. On the top of the Symbicort inhaler is an actuation counter. The arrow on the counter points to the number of inhalations or puffs you have left. The counter will count down each time you release a puff of medicine. It will count puffs used for preparing your Symbicort inhaler and puffs used when taking the medication. The arrow on the counter will show a yellow area when the counter approaches 20. This lets you know it is time to call your healthcare provider for a refill. It is important that you pay attention to the number of inhalations or puffs left in your Symbicort inhaler by reading the counter. Throw away Symbicort when the counter shows 0. Your Symbicort inhaler may not feel empty and it may continue to operate, but you will not get the right amount of medicine if you keep using it. It is important that you use Symbicort as recommended, twice a day, morning and evening, to help improve lung function. While taking Symbicort, it is important to monitor your symptoms so we can best manage your COPD. Contact your doctor if your COPD does not improve, symptoms get worse, or if you have any questions about using your inhaler.